Hey, Robert Starr here. It's a Wednesday morning, and Wednesdays for me, I spend outside of our practice now. For the first 2.5 years, that wasn't the case, but I find that having some time to work on the business away from the business is sometimes the best way to clear my head, and it's also an opportunity to reflect a little and some of the things that make that possible. So I guess the story of today is not so much because we hear a lot about this whole work on your business, not in your business. So I think we've heard enough about that, but it's also about practically trying to work out how we can realistically do that without getting a million phone calls and a million texts and emails to essentially virtually jump back into our business at a moment's notice. So how we practically go about doing that. Now, from a clinical point of view, one of our core values is to ensure that we don't leave a stone unturned. So that might be trying to solve the problem through every possible resource that we can throw at a problem to help a patient. But it also might be to ensure that we have clear communication and collaboration with our fellow pharmacists. So for example, if we know that we're not going to be available after a certain time, or if we're spending a day out of the practice, in my case, it's making sure that we leave notes for each other in a various amount of ways. One of the biggest things that irritate me is a note that you find in a dispensary basket that says, "See Rob." Now, obviously there's a bit of a problem with that, because if you have a "See Rob" note, well, when someone picks it up, all they're going to know is "See Rob." But Rob's not there, and Rob can't help with this particular scenario, and then you've got to restart the whole process, which is incredibly frustrating for you as the pharmacist, but also for the patient, because they would feel that as a team of pharmacists, we would be able to talk and communicate more. So my lesson for today, and I hope that this is something that we can introduce into our practice every single day, is to ensure that when you look after a patient, if there's a logical step in being able to solve that patient's problem, that needs to stop and wait for something to come back. And it could possibly extend outside of your dedicated shift time, or maybe a day that you're in the pharmacy. Make sure you leave clear notes so that the next pharmacist can pick it up exactly where you saw it and can continue the great care and experience that your pharmacy and you are known for, and really help to uphold our best possible pharmacy practice, which in my view is our only differentiating point in this 21st century. There's plenty of ways to get a transaction in pharmacy, especially the lowest price transaction, but it's the relationship and the way we take care of our patients that counts. And this is one element that I think we often get wrong, but it's one that we should get right. Bye for now.
The podcast you just heard was made using Anchor. Ever thought about making your own podcast? Anchor makes it really easy for anyone to get started. It's a one-stop shop for recording, hosting, and distributing podcasts. Best of all, it's 100% free. Sign up now at anchor.fm/new. That's anchor.fm/new to get started.